Hey there, this is Jim Donovan. Thank you for tuning in. I'm glad you're here with me. Today I'd like to talk about the one thing you can do for safer surgery and quicker recovery. Before we get started, I'd like to invite you to take advantage of a free resource I made for you. It's called the Sound Health Newsletter. In it, I share the latest research in music and health. Plus, you'll learn music and wellness exercises that you can use every day to feel your best. You'll also get discounts and first access to all of my products and events. Remember, it's completely free. Just come visit me at donovanhealth.com to get started today. That's donovanhealth.com. Now, when it comes to major surgeries, there's a fair share of horror stories out there. Trust me, I've had a few myself. But research has shown that there's one simple thing that you can do before, during, and after surgery to reduce your anxiety and improve safety and post-op healing. And I have to say, I wish I had done this before going under the knife. Let me explain. In January of 2019, I had what was supposed to be a routine GI surgery. The doctors told me I would spend 3 days in the hospital, followed by 3 weeks of recovery, and then I'd be back to my normal way of life. But that's not what happened. Not even close. Due to a cascade of complications, including septic shock, 3 surgeries turned into 5, and my recovery time ended up being a whopping 19 weeks long. Not to mention, the pain of having abdominal incisions is nothing like I've ever experienced. But despite all the challenges and discomfort, I'm beyond grateful to have made it out alive and nearly completely healed. Funny enough, I just now came across research on the therapeutic effects of music on people both during and after surgery. I really could have used this about 9 months ago. It got me to thinking about all the ways I could have improved my surgical experience, even if a little bit. So today, I want to tell you what I wish I would have done differently. And should you ever need surgery in the future, I hope you can benefit from my experience in this research. The 2017 study, published in the Libyan Journal of Medicine, studied the effects of music on 140 patients scheduled for GI-related surgeries. The patients were divided into 2 groups. Patients in Group 1 were given portable MP3 players to listen to music of their choice during their surgeries under anesthesia, as well as after their procedures. Patients in Group 2 had surgery without listening to any music. Compared with the people who did not listen to music, researchers found that the patients in the music group had blood pressure that remained significantly more stable after going under anesthesia, a significant reduction in post-surgery pain. 60% of them reported a calm recovery experience. 81% reported a high overall satisfaction rate versus 51% in the non-music group. And 55% of the non-music group exhibited signs of agitation upon waking up from anesthesia, compared to 22% of the music group. The researchers concluded that music therapy is a non-pharmacological, inexpensive, and non-invasive technique to reduce anxiety and enhance satisfaction in surgical patients with 0 side effects. It wasn't until I left the ICU and started the painful process of walking and being active again that I thought to turn on some music. And when I did, I instantly felt comforted and motivated. And best of all, my pain dissipated a bit. For me, it was the music that helped me focus my attention elsewhere and improve my health more quickly. If I had it to do all over again, and I sure hope that's not the case, I would insist on bringing music with me into the operating room. The takeaway for today is that if you have to undergo surgery, or even a simple outpatient procedure, or even a visit to the dentist, consider talking to your doctor ahead of time about bringing music with you. Maybe this will even help them to learn something new while you're at it. Most importantly, never be afraid to advocate for yourself and your health, especially when the science shows the undeniable benefits. After all, there is only one you, and we would like to keep you on the planet. If you have a story about the healing effects of music that you'd like to share with us, drop me a line at feedback@donovanhealth.com or just leave me a comment on the Jim Donovan Sound Health Facebook page. I hope you make taking impeccable care of yourself non-negotiable. Well, that's it for today. I appreciate you tuning in. Remember to come see us on our social media channels on Facebook, Instagram, Twitter, and YouTube. Just search Jim Donovan Sound Health. Now, before you go, I'd like to let you know about a free resource I made for you. It's called the Sound Health Newsletter. In it, I share the latest research in music and health in an easy-to-understand form. I also share beginner-friendly music and wellness exercises that you can use every day to feel your best. When you sign up, you also get discounts and first access to all of my sound health products and events. Remember, it's completely free. If you'd like it, just visit donovanhealth.com and enter your name and email address, and I'll start sending you new issues right away. While you're on the website, you can also read full transcripts of this show and check out a ton of other valuable resources. If you have any feedback, send me an email to feedback@donovanhealth.com. All the information presented on this show is for educational purposes only and should not be considered medical advice. Lastly, come and visit me on our Sound Health Facebook, Twitter, Instagram, and YouTube channels. I'd love to see you there. The Sound Health Podcast is produced by OmniVista Health Learning and Donovan Health Solutions. For Sound Health, this is Jim Donovan. See you next time. Take care.